If you're currently healthy and, you really don't take many medications, you might be looking at your options right now and thinking you can just skip Medicare Part D entirely. I mean, why pay for prescription drug coverage you aren't even using, right? Well, that specific decision could actually cost you a permanent financial penalty for the rest of your life. It is a massive trap that so many people fall into. But here is the genuinely good news. And it is very good news. The year 2026 brings some of the biggest, most impactful improvements to Part D in years, including a hard, absolute cap on what you'll ever pay for your medications in a single year. Welcome to The Explainer. Today, we're going to break down exactly what Part D covers, what it will actually cost you in 2026, and the specific changes that could genuinely save you a significant amount of money.
So let's just quickly look at our roadmap for today's Explainer. We'll cover 1. What is Part D? 2. 2026 costs. 3. Insulin and vaccines. 4. The late enrollment penalty. And 5. Choosing a plan.
All right, Section 1, what is Part D? Let's get a foundational understanding of prescription drug coverage. So unlike Medicare Parts A and B, which are run directly by the federal government, Part D plans are actually sold by private insurance companies. And there are two main ways to get this coverage. First, you've got a standalone prescription drug plan, often called a PDP, which you add if you have original Medicare. The second option is a Medicare Advantage plan, or an MAPD, where that drug coverage is just already built in and bundled with your health coverage. But either way, these private companies are tightly regulated by Medicare, and their ultimate goal is exactly the same, right? To help cover the cost of the medications your doctor prescribes, whether that's just a routine, generic blood pressure pill or a highly specialized drug for a chronic condition.
Now, because Part D is sold by private companies, your specific plan choice matters enormously. And that brings us to, honestly, the most important word in all of Medicare Part D, the formulary. Basically, a formulary is simply a specific list of covered drugs and the pricing tiers that are unique to each individual Medicare Part D plan. Every single plan has its own formulary. So Plan A might cover your specific medication on a really cheap generic tier, while Plan B might put that exact same medication on a way more expensive tier. Or honestly, they might not cover it at all. Understanding that your plan's formulary dictates your costs is absolutely key to mastering Part D.
Moving right along to Section 2, 2026 costs, focusing on base premiums, deductibles, and the new caps.
What's really incredible about the 2026 numbers is the level of predictability brought about by the Inflation Reduction Act. The first number you absolutely need to know is $38.99. This is the 2026 National Base Beneficiary Premium per month. Now, to be clear, this is a benchmark figure used to calculate Part D costs. Your actual premium is going to depend on your specific plan. It could be a bit higher or it could be lower. But the really fantastic news here is that this base premium cannot increase by more than 6% per year all the way through 2029. That rule gives us a kind of financial predictability we simply didn't have before.
Next up, we have the standard Part D deductible. For 2026, that number is $1,615. That's a slight increase of $25 from the $590 deductible we saw in 2025. This is the amount you have to pay out of your own pocket before your plan steps in and starts sharing the costs of your medications. However, keep in mind that because these are private plans, some are going to offer lower deductibles, and some plans will even offer $0 deductibles, just depending on how they structure their benefits.
So here's the crucial point, the absolute hero number of 2026, $2,100. This is the annual out-of-pocket cap for covered medications. I really want to emphasize how incredibly important this is. Under the old system, there was no real hard cap on what you might have to spend if you were taking very expensive medications. For anyone managing a complex health condition, costs could just spiral endlessly. But for 2026, once you've spent $2,100 out of pocket on your covered medications, and yes, your deductible does count toward that, everything changes.
Hitting that $2,100 cap instantly pushes you into what is called the catastrophic coverage phase. Once you're in this phase, your plan covers 100% of your covered medication costs for the remainder of the calendar year. You pay zero. Nothing. This is a direct result of the Inflation Reduction Act, and it's a massive, highly beneficial improvement over the old limitless system. It provides this total peace of mind that no matter what health crisis pops up, your medication costs have a strict, unbreakable ceiling.
Okay, let's jump into Section 3, insulin and vaccines, and look at some very wallet-friendly updates.
For anyone who manages diabetes, or maybe has a loved one who does, this number is an absolute breath of fresh air, $35. Under the new rules, the cost-sharing amount for each covered insulin product is permanently capped at a maximum of just $35 for a one-month supply. And what's really brilliant about this is that your standard Part D deductible doesn't even apply to insulin. From day one of the year, your covered insulin is capped at $35.
And then we have $0.
This applies to recommended adult vaccines. We're talking things like the shingles vaccine, the RSV vaccine, and others recommended by the CDC's Advisory Committee on Immunization Practices. These are fully covered under Part D. That means zero deductible and zero cost sharing. They are completely 100% free under your Part D plan. It's concrete, proactive healthcare, completely without the financial friction.
We do need to pivot now to a calm but very serious cautionary note. Section 4, the late enrollment penalty and why timing absolutely matters.
So if you go 63 days or more without Part D coverage or other creditable prescription drug coverage after you first become eligible, you're going to face a penalty. Let's break down exactly how this math works so you can see why it's so dangerous. Medicare takes the number of full months you went without coverage and multiplies it by 1% of the national base premium, which, as we just talked about, is $38.99 in 2026. Whatever that final dollar amount is, it gets added to your premium. But here is the kicker. It's added every single month for as long as you have Part D, literally for the rest of your life. It never goes away.
You know, this quote perfectly summarizes the reality of healthcare. Healthy today does not mean healthy in 5 years. And this is exactly why enrolling in a basic, low-cost Part D plan right now makes absolute financial sense. Even if you're perfectly healthy today and don't take a single prescription medication, getting a low-premium plan protects you from this lifetime penalty. Just think of it as cheap penalty insurance. You're really just protecting your future self.
So, knowing all of this, how do we actually take empowered action? Let's move to Section 5, choosing a plan and finding the right fit.
Picking a plan really shouldn't be a guessing game. It's about actively evaluating your options so you don't end up surprised by hidden medication costs in the middle of the year. Here are the 3 essential steps you have to take. Step 1. Write down a literal list of every single medication you currently take, and make sure to include the exact dosages. Step 2. You have to check each prospective plan's formulary to make sure your exact medications are covered, and see what pricing tier they're on. This is absolutely vital, because a plan with a super low monthly premium might actually end up costing you way more over the course of the year if your specific drugs aren't well covered on their formulary. And Step 3. Use the official Medicare Plan Finder tool to do all the heavy lifting for you.
Seriously, I cannot emphasize this enough. Take 15 minutes to use the Medicare Plan Finder. It's a completely free tool located right at Medicare.gov. All you do is enter your specific zip code and your exact medication list. The system will then calculate and show you highly personalized, totally transparent estimates of what your actual annual cost will be for every plan available in your area. It does all the complicated formulary cross-referencing for you. It's easily the single most useful thing you can do before making your final enrollment decision. Let's just do a really quick recap of the core takeaways from today's explainer. Remember, Medicare Part D is prescription drug coverage offered through private plans, which means you must check their specific formularies. The 2026 changes are huge. We've got that incredible $2,100 out-of-pocket cap that protects you from catastrophic costs. You also benefit from capped insulin at $35 a month and $0 recommended vaccines. And finally, you have to remember the permanent late enrollment penalty. Enrolling on time is non-negotiable if you want to avoid lifelong extra fees. I want to leave you with a thought to reflect on. You might be healthy today, but what is your actual plan for the medications of tomorrow? Are you protecting yourself from penalties, and are you positioned to take full advantage of these new cost caps? If you take anything away from this explainer, let it be this. Take control of your coverage. Have you taken 15 minutes to check your medications on the Medicare Plan Finder yet? The tools are all there, the 2026 savings are very real, and the next step is entirely up to you. Keep learning, keep exploring your options, and make the choice that secures both your health and your wallet.